Welcome to this brief look into an internal carotid artery stenosis and how it's treated with an endarterectomy. First, here's a healthy internal carotid artery in sagittal view. Notice the smooth, wide lumen and uniform color flow. Now compare that to this internal carotid artery with significant stenosis. Plaque buildup has narrowed the artery's lumen, creating much higher than normal velocities. You can see color aliasing here, blood speeds exceeding the color scale limit. Transverse view, we can see the artery's diameter is visibly reduced. Doppler shows high peak velocities, classic evidence of a stenosis. One common surgical fix is an endarterectomy. The surgeon opens the artery and carefully removes plaque lining the vessel wall, improving flow and reducing stroke risk. Now, this is the same stenotic artery after an endarterectomy. The previously narrowed lumen is now wide open. Color flow looks smoother and more uniform. No more high velocity jets or aliasing from the tight lumen. Here's a side-by-side look. Pre-endarterectomy with visible plaque and turbulent flow, and post-endarterectomy with significantly improved patency. This highlights how effective plaque removal can be in restoring normal flow.